Hello friends, it's nice to be back on the video. Did you know that erectile dysfunction or penile disease can be a harbinger of a serious disease inside the body? Up to now, I have been talking to you as erectile dysfunction being a disease. Today, let's go into the in-depth a bit. And indeed, erectile dysfunction is not a disease. It is a symptom of a serious disease in the body in many cases. How's that? Let's take the example of diabetes, for instance. Diabetes is a God-forsaken disease which affects the nerves, the muscles, the vessels, hormone levels. Everything is affected by diabetes. And therefore, it causes early damage to the blood supply to the penis, the nerve supply, the hormones supplying the penis. And therefore, erectile dysfunction occurs early in case of diabetes. Let's turn it around a bit. In a patient with erectile dysfunction, there is a high chance of him being a diabetic. Now, isn't that interesting? I have picked up many cases of diabetes just because they had erectile dysfunction to start with. So the dictum should be that in all cases of diabetes, particularly in the younger age group, erectile dysfunction should be actively looked for. And in all cases of erectile dysfunction, diabetes angle should always be taken into account and be looked for. Let's take another example. In coronary artery disease or disease of the heart, there is a blockage of the blood vessels. Now, interestingly, the blood vessels of the heart are similar to the blood vessels to the penis, except that in the penis they are 1 millimeter in diameter and the heart they are 3 millimeters in diameter. So which will block first? The 1 millimeter diameter one, which is the penis. And here's the interesting fact that in cases of high risk cardiac disease, I'll tell you what these are a bit later, but what is interesting is that in cases of high risk patients for cardiac disease, erectile dysfunction, the first symptom to appear. As I said before in diabetes, let's turn it around. In a case of erectile dysfunction with a high risk cardiac profile, there's a very high chance of the patient having a heart attack sometime after the erectile dysfunction. And researchers have found out that it's about 2 years after erectile dysfunction that a heart attack occurs. It is very important from mankind point of view. Up to now, we've been trying to prevent a heart attack. Here, we've got a warning symptom from the Almighty that erectile dysfunction has occurred and can be followed by a heart attack. So in these 2 years, if you can prevent damage to the blood vessels, nerves, muscles by improving the various factors which I've mentioned before in my videos, then we can actually prevent a heart attack. Big thing, because heart muscle once lost is never regained. And if you can prevent that loss of muscle mass of the heart, all the better. So it follows therefore that if you take erectile dysfunction as a symptom and not as a disease, you can look at the more serious diseases of the human being and may actually be able to prevent certain diseases. Oh yes, I was going to talk to you about what are the high-risk patients. High-risk patients of cardiac disease are those patients in which the family history goes of a similar cardiac attack in the early period of their life. Number two, chronic smokers, chronic alcoholics, then patients with living in a polluted atmosphere, patients who got diabetic prevalence or full-blown diabetes or precursor of diabetes, or patients with diet irregularities. These are all high-risk patients for cardiac disease, and they have to be particularly careful of health. If they have erectile dysfunction and they are in the cardiac risk group, they should be evaluated for problems related to heart. And as I said before, if they are treated properly, if their preventive measures are taken for the heart, then we can actually prevent patient from having a heart attack. Similarly, we have blood pressure problems. What happens is blood pressure, the peripheral arteries go into a spasm, and therefore the heart has to pump more in order to flow to the periphery. This causes high blood pressure, and the same phenomena occurs in the penis. So erectile dysfunction may actually be another first symptom in blood pressure problems. A simple test in a patient of erectile dysfunction, if you take his blood pressure and if it's very high, then you know that you've got systemic disease behind that. What I'm trying to say is that up to now we've been talking of erectile dysfunction as a disease, but it may actually be a blessing in disguise in the form of symptom of a serious disease in the body. Very often we find executives complaining of burnout syndrome. What is it, burnout syndrome? Patient feels lethargic, he feels confused, he feels sleepy all the time, and he has got erectile dysfunction. He goes to his GP and the GP puts him on B12 complex, vitamins, tells him to take another diet, salads, etc. But the main problem is low male hormone in these patients. And if the erectile dysfunction is taken as a symptom of low testosterone levels in the body, then only we'll get the test done. And once we get the test done, we find out that the male hormone levels are actually low. And these patients respond to testosterone increasing treatment, which would have been missed if one concentrates only on the general symptoms of the patient. Very helpful in cases of high-flying executives with a high stress level. They come to you with erectile dysfunction, you get a serum testosterone level, total and free level, and bingo, you find that level is low, you correct that level, and the patient recovers. Whereas what happens is, if he goes to a GP, he's given all sorts of vitamins and all sorts of other treatment. Nothing is going to work till you improve the male hormone level. And that, my friend, is the crux of the matter. Erectile dysfunction is a curse to many. Many feel dejected with their life. But here I'm giving you another angle to it. It may be a curse, but it may be a blessing in disguise also, because all the diseases that occur in the human body in which erectile dysfunction occurs are serious in nature. Diabetes, you have to take medicines lifelong. It affects all the systems of the body. Heart disease, again, if there's a heart attack, the tissue loss of the cardiac muscle never regenerates. And if you can prevent that, good for the patient. High blood pressure can cause a lot of problems, and if it's detected early, precautions can be taken. And as for the burnout syndrome, the treatment is very simple, provided you listen to the penis. This is what I call penile monologue. It keeps on telling you all the time, look, take care, take care, take care. And we are so engrossed in the loss of penile activity that we forget to look at the person as a whole. So gone are the days when erectile dysfunction was treated with medicines and none of the tests were done. I think time has come now to look at it more carefully and prevent major diseases from the human being. It's another perception, it's another thought. What I've said today, I've described in details in a few videos of mine. If you look at my video on cardiac health, then you can get a detailed information about this. If you look at my video about diabetes and erectile dysfunction, then you'll get more information about the same problem. I've just made a gist out of those videos. If you want detailed information, you can consult those videos.